Now I'll invite the Vice Chancellor of Dow University of Health Sciences, Professor Masood Hameed Khan, to give the inaugural speech. Professor Masood Hameed Khan.
A'udhu billahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Honorable Chief Guest, Professor Sayyid Sibtul Hasnain Saab, President Pakistan Medical and Dental Council, Pro Vice Chancellor Dow University, Deans, Principals and Deans of medical colleges from all over Pakistan, faculty members, friends from media, ladies and gentlemen, Assalamu alaikum. I, on behalf of Dow University of Health Sciences, welcome all of you to this conference on medical education. I am grateful to President PMDC for accepting our invitation and honoring Dow University of Health Sciences to be here this morning for this very important cause. At PMDC, we have been working for bringing change in medical education, both undergraduate and postgraduate. And when we, as university, placed the proposal before PMDC, PMDC was very kind enough to give permission to universities to go ahead and bring change in the curriculum. Sir, we are really grateful to you for that kind gesture. And as a result of that, many universities and medical colleges in Pakistan, they started changing their curriculum. We at Dow University also. First we shifted on to semester system and then later on to the modular curriculum, which is vertically integrated. Now when we started off with this, we started facing issues also. But Alhamdulillah, with the help of our faculty members and the guidance of medical educationists, we have been able to solve many problems. But still there are many questions which needs to be addressed and resolved. So that's why university decided to have a forum of all stakeholders. And I'm so glad to see that we have people from all over Pakistan, all policy makers, deans, principals, as well as above all, we are honored by your presence, sir, that the recommendation of this elite group, once it will be submitted to PMDC, I am sure that PMDC would take a note of it, and then in the committee of PMDC will come out with recommendations for the regulations for adopting a curriculum which is in alignment with what is happening world over. When we talk about curriculum, and when we were having brainstorming meeting, we kept in our mind the graduates for the year 2020. And that is the vision which we are working. That a person, a student who is admitted in 2010, once he graduates in 2015, does his post-graduation for 4 years, so he is in 2020 or 2019 and 2020. Now in that year, what will be the requirement of the community? What will be the requirement of the world over? What the world would be expecting? And that is where we have to think and we have to design our curriculum right at this moment. So I am hopeful that the panel of experts which we have, the groups which will be meeting this afternoon and tomorrow morning, will be able to give guidance for bringing in change for undergraduate medical curriculum so as to produce human resource and doctors for the future. I am also grateful to the faculty members of Dow University of Health Sciences that we have been bringing in changes very rapidly. As all of you know that this university was established December 29, 2003. We started working on 14 January 2004, and since then, very rapid changes have been brought in the examination methodology, evaluation, in the teaching methodology, and in the curriculum. We were faced with the problem of a public sector university having 3 medical colleges, 1 dental college, and huge number of students. And that was the only thing which we were afraid of, that whether we will be successful in implementing this modular curriculum or not. But here I must say that I am really grateful to all the faculty members that in no time, they organized this curriculum, they are working on this curriculum, and they have implemented this curriculum. Especially I am grateful to the Chairman Curriculum Committee, Professor Salahuddin Afsar, for taking the lead and taking the initiative for implementing the curriculum at Dow University of Health Sciences. Other universities in this country are also, they have adopted, but whenever we have met at different conferences, we were discussing and we used to discuss about the issues. Like this morning also we were discussing that Ziauddin has few issues. We also, and maybe the other universities, so we said that let's discuss them on a common platform. And this is the platform where I am sure that whatever the issues are with this modern curriculum and modular curriculum will be addressed, and recommendation would be given to Pakistan Medical and Dental Council, where at present the environment is so conducive, so friendly for medical education, that I am sure that with yourself, sir, sitting in the chair, we will have this work done also, like so many other projects have been completed under your guidance at PMDC. Ladies and gentlemen, I would like to mention over here that as Pakistani and as Pakistani doctors, our graduates are serving all over the world. Let's take the example of North America, and when you see them, you meet them, we find them enjoying the best of the best positions. And these graduates have done their graduation from medical colleges of Pakistan. They have been trained and taught in the conventional curriculum, as I am also the product of that curriculum. And they are doing so well. But still we realize that as the world is moving, we have to move with the world. And that's why we are for a change. And this change for the better would produce even far better doctors. It is a question of providing environment. Like my friends, when they did their ECFMG at that time, when they went over there, we had discussions with them. They came up with the issue of research, methodology, biostats, and that shortage in the curriculum. And once we have provided them, the recent students, I would just like to share that recently, when we had a Student Research Day, 41 research papers were presented by the students of 4th year at Dow Medical College. Now, mentioning this, I would like to appreciate the fact, and we all know, that as Pakistani nation, we are very strong, we are very intelligent, we are very hardworking, and the proof I have given to you, that when we go out, best of the best engineers in the world, best of the best doctors, yes, Pakistanis, and people feel pride in seeing these Pakistani doctors abroad. It is only a matter of providing them the environment, and hopefully, inshallah, we will provide them this environment. We as a nation are so fortunate that in this country, when we talk about medical education is so economical that if you compare it with, say, United States once again, people have to pay about 50 to 60,000 US dollar for 1 year tuition fee for MD program. And what we are paying over here, what we have paid. Myself, When I was a student, I paid about 144 rupees for 1 year as tuition fee. Still, we are charging in public sector university about 20 to 25,000 rupees for 1 year tuition fee. So we are blessed, but we must also realize that it is because of this country. It is because of the taxpayer money that we have become doctor, and it is our duty to serve this nation. And we must always respect this country as we are doing, and we are also positive that inshallah ta'ala, with the future leadership coming up, with the future generation, where I see the doctors working day in and day night under the adverse circumstances, under the circumstances which are given to us. So much is being delivered in this country. You talk about any public sector medical college, you talk about any private sector medical college and hospital, you talk about the healthcare system. We are very positive that inshallah ta'ala, with the help of this younger generation, we will be able to bring change, and we will be able to put Pakistan on world's map of medical education. With this, I am really grateful to all the members of the organizing committee, especially the chairman, the organizers, as well as to all of you, that you have made it possible to be here for a cause, and I am sure that deliberations out of this conference would go a long way in the history of medical education in Pakistan. Sir, I am really grateful to you that you have taken time out to be here this morning, and I am very sure that we will gain from your expertise, from your long experience in the field of medicine, and from your position at PMDC, where you have been representing Pakistan outside, representing Pakistan at various forums, and getting laurels for Pakistan. I am really grateful to all of you. Thank you very much.